pleasant good morning from Broadcasting House. Welcome to our program, Good Morning Leone, the program that starts your day with news, comments, views on current happenings. I am Princess Gibson, teaming up
Emmanuel Samoa.
Our quote for the day is an interesting one, and it's from a British actress, Audrey Hepburn, and it says, "Nothing is impossible." The word itself says impossible, so nothing is impossible under the earth. You can do it. Coming up in this edition, Focus 1000 launches global initiative to enhance international partnership. Sierra Leone Student Entrepreneurship Network to embark on entrepreneurship awareness campaign and baseline survey to promote student entrepreneurs in Sierra Leone, and Caritas Freetown to implement projects geared towards improving health of malnourished children in 15 vulnerable communities. You can be part of the program by participating through text messages to the number 0300 or find us on Facebook at SLBS Live or Channel 31 and other social media handles. It's Good Morning Leone. Stay with us. Focus 1000 has launched its global initiative geared towards creating space for international partnership in achieving its goals. During the launching, representatives from the global initiative assured Focus 1000 of their commitment and support to ensure the organization gets the international partnership they desire, especially in improving on research techniques and the health sector of the country. Well, in the studios to further bring conversation on this initiative, we have been joined by Professor Dan Smith. Good morning and welcome to the show.
Good morning.
We also have Scott Owata of Focus 1000 Global Initiative. Good morning.
Good morning, thank you.
It's a pleasure having you on the show. So I start with Scott Owata. Can we have the background to this global partnership initiative?
Sure. The background of the initiative is Al-Haji Mohammed Bailar Jallo has been our friend for close to 40 years now. Dan and I were in the Peace Corps here. I started in 1984, I came home in 1986. Dan actually stayed 3.5 years. He came home in 1987. When we were in the Peace Corps, Mr. Jallo was the training director. He was attached to primary healthcare in McKinney at the time. And from that time, 40 years ago, we've been friends and we've stayed in touch. Mr. Jallo actually lives, when he's in the United States, he lives near where I live. And our families know each other. And we've often had conversations about what we can do on the U.S. side to help and support Focus 1000 in Sierra Leone. So that's how Focus 1000 Global has come about. It's an initiative to help support Focus 1000 in Sierra Leone on a local level.
Okay, so let's talk about the global initiative itself. How does this work?
How does this work?
Yes. What do you aim to achieve and how is it organized?
Well, again, it's a new initiative and we're working on building an infrastructure. Part of what we want to do is we've had this long-term personal relationship with Mr. Jallo, and we want to turn that into more of an institutional relationship that will sustain itself for years to come. You know, we're getting older in age. I'm going to retire this year. Mr. Jallo worked for UNICEF for many years. He's retired now. So part of what we're trying to do in establishing this relationship is really around sustainability and support.
So does it take on board existing programs around motherhood, child health initiative?
Yes. Focus 1000 Global is not there to dictate to Focus 1000 Sierra Leone. It's really to find ways to support the initiative in Sierra Leone. You know, it's not there to recreate the wheel.
Okay, continue to stay with us. I move on to Professor Dan Smith. Now you are looking at research. What will this research focus on?
The research will focus on building the capacity and the skills that are already quite considerable of local staff who have been carrying out research for Focus 1000 since its founding in 2012. But like anything in life, we can grow, we can learn, we can do more and do better. And so for me as a university professor in the United States, I have access to other faculty members, to postdoctoral fellows, to graduate students and bachelor students who are interested in learning about Africa, but also interested in contributing to the kinds of programs that Focus 1000 engages in. Let me give you one example. Focus 1000 is a key partner in something called the CHAMPS program, which is an initiative that looks at the causes of mortality among children who die before the age of 5. And they've been doing serious medical, biological research to determine what actually kills small children. But the challenge, once you know what the killers are, once you know what is making children die before they should, the challenge is to turn that research into action, turn that research into policies and programs that make a difference. And research doesn't end with just finding the causes of the morbidity and the mortality. Even the pathway to moving from knowing what is killing children to creating contexts which keep them alive, that also requires research. So from my end, I'm an anthropologist. I do social and behavioral research. And one of the things we hope to strengthen with CHAMPS and with Focus 1000 is the capacity to do the social science research, to produce publications that showcase the findings so they can be used not only by Focus 1000, not only in Sierra Leone, but across the continent, but also to acknowledge and address the reality that the initial research determining what kills children is just the first step. There's so many steps after that that require understanding the community, understanding politics and culture and society and so on. And so by engaging in further research with Focus 1000, we hope to expand the reach and the process by which the research itself transforms into action.
So what's the methodology for this research?
There are a lot of methodologies. So with the biological research, they're doing tissue samples from children who have died premature deaths, and they're doing microbiology. But for the social science research, it includes epidemiology, like tracking in communities how diseases spread, who gets them, what kind of circumstances cause the children to get the diseases. But it also involves qualitative research, interviewing people, studying the social context, doing participant observation, what in anthropology we call ethnography, and then turning that social science research into findings, into conclusions, into recommendations for how to move forward with policy and programs.
We know when you guys will be coming to do this research, you have a catalog of research that you want to do. So can you please just brief us on the shorts, the most immediate research that you'll be embarking on?
So as my friend and colleague Scott mentioned, we are not driving the research agenda. We will take the lead from Focus 1000 in Sierra Leone. So already there's an incredibly impressive team of people in Sierra Leone doing research on child mortality. So the precise agenda for our research will be driven by the priorities of Focus Sierra Leone. So our role, my role, the role of the people that I might be able to bring from universities in the United States is not to set the research agenda. It's to learn about and support the research agenda that's driven by local priorities.
So we know we already have labs in Sierra Leone that people do this public health lab. Will you be having partnership with them to bring them on board, you do the research together?
Absolutely. I mean, the whole key to the success of moving primary health care and prevention of maternal and child death and so on, the whole key to success is partnership with government, with NGOs, with civil society, with community organizations. So the kind of research that one does in social and behavioral research has to cut across all those different sectors of society. If you miss one, you've missed part of the problem. You have to study them each individually, but study them together comprehensively.
So when you are talking about this one, it's like this one is a good news for Sierra Leone. So when should Sierra Leone start to expect publications of the issues around infant mortality and other health issues?
Well, you don't have to wait to expect them. They're already happening. even before we are joining the research effort, Focus 1000 has generated up to 40 publications in international journals, and they're working on more now. So we are going back to the United States on Sunday, but by this summer I expect at least 2 students from Brown University, advanced students, Masters of Public Health students, to come to Sierra Leone and work with the CHAMPS program. And they'll be working with local staff to take the research they've already done and move them toward publication. So it's not a question of waiting, it's already happening. It's a question of expansion.
So what's the framework for this research? The time frame, sorry.
The time frame, I mean, like I said, it's already ongoing. Brown University, my university's role, will really begin around June. But there's no end framework, right? There's no ending time. Like, we envision this as a partnership that will go beyond even our own involvement. I mean, as Scott said in the introduction, part of our motivation is that we want to transform what is for us a lifelong 40-year relationship with people that we care about in Sierra Leone into something that will last longer than our individual efforts. We want to institutionalize it. We want to reach the community good, the national good. So there's no end time frame. We are beginning something that we hope will continue even beyond our own involvement.
Okay, continue to stay with us, Professor Dan Smith. Yes, Emmanuel.
Yes. To another issue, the Sierra Leone Student Entrepreneurship Network is to embark on an entrepreneurship awareness campaign and baseline survey on student entrepreneurs in Sierra Leone. The initiative aims to raise awareness, gather data, and foster a supportive system for student entrepreneurs across the nation. The project will be launched next month. For more on the issue, we have in the studio Sarah Kamara, the founder of Sierra Leone Student Entrepreneurs Network. Good morning and welcome.
Good morning.
So firstly, I want to ask, what do you guys aim to achieve?
Okay, so we deal with students and we want to see how best we can provide support and then promote them in their entrepreneurship endeavors. So we can do that without having the data to know the total number of students that we have that are practicing entrepreneurship already. So that is the main aim that we want to get the data that will help us to present to policymakers and the government as a whole, and then to people that have interest in entrepreneurship. Because we deal with students who are into various skills endeavors, and they want so many support, but we can't connect them to the people that will provide for them the support without us having the data about how many of them are into it.
So what are some of the tools you guys will use to determine that a particular student is an entrepreneur?
Well, first off, by questioning you and you responded, that will tell us that you are into it, because as an entrepreneur, even by you explaining what you do will tell us what you're doing. And another thing is we will go around to see their businesses and to see some of those things they are into.
So those and data that you be gathering, aside of you saying linking them to business people want to really know what will you guys be doing with those data itself. Okay,
the data will be in it's an added advantage for us to see how best we can achieve our goal. Because the goal of Sierra Leone is to create, promote, and develop student entrepreneurs across all higher learning institutions in Sierra Leone. And we having those data in our own possession will help us to make decisions and to plan better for the future.
When you talk about entrepreneurship, it's cut across different fields. So, do you guys have specific field that you'll be going to do research or survey of students that are into it?
Okay, so the target is the entire student entrepreneurs in Sierra Leone. Okay, so we are yet to have them by categories, and that is what we want to do. We want to know those that are into agriculture, those that are into innovation, those that are into the various type of entrepreneurship practices. By that, we can see how best we can come in.
Okay. If I'm an entrepreneur, then I'm into agriculture, then you guys meet me, then I tell you that I'm an entrepreneur. What will be that thing that you do that will say, oh, let me encourage these people to talk to me further?
Come again, please, sorry.
If I'm an entrepreneur, I'm into agriculture,
okay.
Then you meet me, say, okay, we want to do this survey, but we want to question you. What will be those words or those things that you tell me to convince me that indeed your venture will help me?
First off, we'll educate you more about the importance and the value and the advantageous part of what you're doing. Like we open your eyes to see the opportunities that is lying ahead of you, that you will stand to gain if you continue what you're doing. We had dealing with students, as I said earlier, and we all here know the challenges students have been facing, like particularly graduates after university. So these are the people, when we meet you in this kind of endeavors, will tell you that you already have a job for yourself. It's about you maintaining it and then see how best you can create your own job of employment for yourself in your career.
So let me say, raising this awareness, do you guys aim to broaden your scope to bring more students into this particular thing like entrepreneurship?
Yes, please, that's the goal. As of now, we have 80 members across Sierra Leone, and we have chapters at various universities, the likes of IPAM, FBC, Jalabo campus, and then Tech. So we don't just want to stop there. We want to gain the attention of the entire student in Sierra Leone, like help them to understand that yes, it's good for you to seek for a job, but if you have skills and there is need for you to develop skills, you don't have to sit and wait for government to provide for your job, or you wait for job opportunities to come your way. I can be doing a tailoring business and after university then I go and find a job again. Now we help them to understand that if you improve what you're doing, improve on your skills, there's a job itself for you.
So after you guys have completed the survey, how long will the entrepreneur wait for him or her to get to hear from you guys, to link them with other partners that will make them expand their initiative or business?
Okay, I think we first going to start with the campaign, the awareness campaign. Then it's just going to last for 3 months probably. Then after we'll see how best we can then do the survey online, which we cut across all universities in Sierra Leone. Then after, they will see how best we can process the data, and that will take us 2 months.
Yes, Sarah, let's talk about the credibility of the data. How is that going to be ensured?
Okay, so one of the ways we thought of is to work with the renowned and the authorized data collectors in Sierra Leone, that is statistics. Okay, to see how best we can partner with them. And then all those people that will be there to collect those data will be trained before they embark on this journey. And we are sure that the data will be credible.
Okay, continue to stay with us. She is Sarah Kamara, founder, Sierra Leone Student Entrepreneurship Network. We still have Professor Dan Smith with us in the studio. Let's talk about the findings. After the research, what kind of intervention have you put in place for findings?
Well, the interventions, first of all, Focus 1000 is doing all kinds of interventions based on the things that are already known about maternal and child health in Sierra Leone. But it doesn't mean they know everything. It doesn't mean we anywhere know everything. So the new interventions will depend on the nature of the findings. I can't tell you exactly what kinds of interventions will result from the research, because that presumes that I know what the outcome of the research is going to be. And part of the reason for the research is that there are still things we don't know about the causes and about the ways to address maternal and child health in Sierra Leone. But I can give some examples. I mean, if you discover that there's a new higher priority medical cause for child death, you have to begin to think about what kinds of interventions will address those problems, right? So say you have a program already in place that is dealing with malaria, but you discover that malnutrition is a bigger cause of child death, or another big contributing cause to child death in addition to malaria. You have to start thinking about what kinds of programs can we put in place to address malnutrition. And I think one of the key things to remember about addressing health, well-being in Sierra Leone and anywhere is that it's a multi-pronged, multi-sector reality that one has to address. It's not just going to be immunization or vaccines or treatment that's going to address these problems. You have to address the social context, the political context, the economic context. So many of the things that will come out of this research will be dealing with how you address these more complicated questions, right? I mean, for a long time, we've known many of the medical or biological underlying factors that cause child death. The big, harder questions are the social, the cultural, the economic questions. And so many of the recommendations and interventions that we will try to develop will address those wider kinds of issues.
So let's look at this one that you just made mention of. You talk about medical. Plenty people know about the medical reasons why we have some of these issues. Now let's go over to the social and cultural. What tools will you use to determine, you understand, the causes of the social and cultural causes of the infant mortality?
So the simplest way to put it is that you meet people where they are, whether those people are government workers or NGO workers or community leaders or the people themselves who are suffering from the morbidity and the mortality. So meeting them where they are means asking them, listening to them, watching what is happening, and coming up with an understanding of the complex causes that put people in these conditions of vulnerability. I mean, I think it's important to say that addressing the long-term underlying causes of maternal and child death, unwanted maternal and child death, is not easy. It's not something that we will finish, Sierra Leone or anywhere in the world will finish in 1 year or 2 years and 5 years. But with primary health care, which has been the pillar of Focus 1000's interventions, we begin to put together a constellation of actors, institutions, people who can eventually solve the problem.
So Scott, let me go over to you. You spoke earlier that you guys will be making, your aim is to make Focus 1000 in Sierra Leone becomes sustainable. So paint a mental picture for that common man down there. How are you guys aim to achieve this one?
Well, again, our relationship with Focus 1000 and the Focus 1000 founder goes back 40 years, almost 40 years. And so the goal is for the relationship with Focus 1000 Global, with people in the United States and Europe, to be able to connect and support Focus 1000 Sierra Leone for years to come, you know, and to pass the relationship down to a new generation of younger people and younger professionals to support the organization.
Well, someone will say, someone that's used to follow Focus 1000 program will say Focus 1000 has always got support from outside. So what's difference?
That is true. The organization has always gotten some support from outside. Our goal is to expand that support, and especially with people who have a deep connection to Sierra Leone like ourselves. You know, again, we were both Peace Corps volunteers here starting 40 years ago. I've been back 4 times over the years. My wife and I adopted a child from here who was orphaned during the war. So we have a well-established relationship with the country. We have families who we support here, and we pay school fees like a lot of Peace Corps volunteers have done over the years. Our connection to the country is a lifelong connection. So the goal of Focus 1000 Global is to pass that connection down to the next generation.
Okay, so thank you.
Yes, Professor, you also deal with a project on youth and drug abuse in the US. And now as a nation, one of the issues we are faced with is mass intake of drugs by young people, especially what is locally known here as kush. So just share your thoughts around how could that be addressed?
Well, I think, one of the questions we asked people in Focus 1000, but people we met across Sierra Leone, was like, what is kush? And we don't even know the answer to that yet. Like, no one actually knows.
But it's a combination of many.
It's a combination of many. It probably changes depending on who's concocting the.
Yes.
The
it's locally made. It is imported. It's a combination of many.
But it's a problem that has yet to be fully researched, right? I mean, if we don't know what is in the different kush that people are smoking, if we don't know the full profile of the people who are smoking, if we don't know how is it coming in, is it if we don't know who is profiting from it. I mean, when kush is being sold and people are smoking it and they're lapsing in their responsibilities, they're not going to have the progress that they should have in life. Some people are benefiting from that, right? So there's a chemical research that needs to be done. There's an epidemiological research that needs to be done. There's a social research that needs to be done. We need to know all of it from the micro level, like what are they smoking and what is it actually doing to their bodies, to the macro level, like Who's benefiting from this? Who is importing it, or who is, all these questions are still to be determined. Right now, I don't think enough is being done to address the problem. But before you can address a problem, you have to fully understand what is the totality of the problem. What are the underlying conditions that lead people to use Kush? I mean, it's a complex issue, and one in which I think there's much research to be done at every level, not just by an anthropologist or a social scientist, not just by a chemist, not just by a public health person. Everyone has to join hand to figure out what's going on, and then we can address the problem.
Okay, at the moment we have concentrated on law enforcement, rehabilitation, but you think research should be the first step?
Yes, because without the data, without the evidence, without a sure understanding of the dimensions of the problem, it's likely that we might make mistakes in the ways we try to intervene to curtail it. So if you don't know what the cause of something is, you can't put together something to address that cause.
But there could be an underlying social problems, employment, economic issues.
No question about it. I mean, I think not only in Sierra Leone, but anywhere in the world, underlying social and economic and political problems are often at the heart of more proximate problems with health, with addiction, and so on. And in the end, those problems, those underlying problems, call on us even further to join hands across different sectors, whether it's men and women joining hands, or different religions joining hands, or government and the private sector joining hands. These complex problems require complex solutions with everybody involved.
Okay, many thanks, Professor Dan Smith and Scott, author from Focus 1000. Many thanks for joining us in the studio. Cabo.
Couché, couché.
Because we have been speaking when you came in. So Cabo for joining us.
Thank you.
We suffer gladly. We thank you.
We gladly pass Mark South.
Yeah, okay. It's a pleasure. Okay, if you are just joining us, this is Good Morning Sierra Leone. We are going for a short break. When we come back, we deal with other interesting issues, including an malnourished project that is being put together by Caritas.
As a mother of the house, whenever I want to prepare palm soup, there's no need pounding palm fruit. All I need is Nkulenu's Ghana's original palm soup base. My soup is done, and its preparation, it is not difficult at all. Nkulenu palm soup base, it's easily done with no difficulties. Just take few
Welcome back to the show. This is Good Morning Sierra Leone on the Sierra Leone Broadcasting Corporation. When we continue with the show, Caritas Freetown will be implementing a project titled Improved Nutritional Intervention for the Treatment of Acute Malnutrition in the Western Area. The project is geared towards improving the health of malnourished children in 15 vulnerable communities in the Western area for 12 months by training the mothers and caregivers to prepare a high protein diet for these malnourished children and also basic hygiene practices. Sabina Thompson is the team lead of the nutrition project of Caritas. Good morning.
Good morning.
So firstly, I'm in the Western area. I want to know, did you guys do any survey that informed that Western area has acute malnutrition issue?
Yes, we did. This project has been in motion from 2017. We did a survey during the Ebola season, and then when they actually reached out to some of those communities that we are targeting, they found out that there are many children who are living with malnutrition. So basically we wrote a proposal, and then we send it to our partners, Caritas Germany, for them for funding. So this project has been in existence from 2017, and we have implemented it in over 45 communities in both Western area and Western rural communities.
So in amongst the communities that you are working, so can you just please highlight the communities with the highest acute malnutrition cases? Well,
one of our most vulnerable communities that we are working with is Tombo community, which is a fishing community. It may interest you to know that we have worked with them for the last 7 years. Other communities, we have interchanged them over the years, but with Tombo, it may interest you to know that we have been working with them for the last 7 years. We are yet to know the underlying causes of why is it that it is very prevalent there, but we have embedded in looking out now at teaching the mothers through education so that it will be part of them.
So aside of Tombo community, where you guys are yet to ascertain the prevalence of malnutrition, in the Western area in general, when we learn what could be the underlying causes for acute malnutrition in the Western area and not in other parts of the country, when you know everything in Sierra Leone is concentrated directly in the Western area?
Western area is very deep. We are actually seeing the surfacing of Western area, but when we walk deep into communities, for instance in the Newton communities, the Mambowe communities, even Ugbangba communities, those are communities that are in Western area but are in further parts of the Western area. So there are more malnourished children in those parts of the Western area communities.
Yeah, you mentioned that you are training mothers and caregivers how to make diets for the kids. What's new are you teaching them? Is it about knowledge or about availability of the food itself?
We are teaching them both. We are teaching them how to prepare the high protein diet food, which is locally called Benimix with different condiments, locally produced condiments, locally sourced condiments, and also we are training them on how they should feed these children, because to have the knowledge is one, how to prepare it is another one, and how to give these children this prepared food is also another one. For instance, you can have a child of 6 months. You cannot give the formula for a 6-month baby to that of a 2-year-old.
So when we talk about this particular one, you just drew my attention. Now, some in those communities that you mentioned that are in the farther part of the Western area, some parents will tell you that they do not have the money or the funds to prepare this local Benimix that you guys intend to teach them. You understand? Mm-hmm. So is it only about teaching them how to prepare Benimix with other locally sourced condiments or other things that are more easy, that will be more easy for mothers to get?
Well, like I said initially, these are locally sourced condiments. For instance, most family uses rice at home. Most family made use of palm oil at home. Most family uses sugar. Most family uses fish. These are the condiments that have been used to prepare the high protein diet food. And they are easily sourced out because they are locally made, and then they are cheaper compared to those imported baby formulas. So as much as we are only teaching them for a start, we are also providing them with these condiments to prepare this high protein diet food for their babies free.
So in your findings, what did you gather for malnutrition?
Well, we gathered based on survey that we did. We found out that 33% of children are living with malnutrition in Sierra Leone. 176,269 of those children are suffering from acute malnutrition, and from that number 63,362 are severely malnourished and are at the risk of dying. This is a survey that was done by UNICEF in 2019. So because of these numbers, Caritas Freetown, with support from Caritas Germany, deem it fit to intervene to see how best we can curtail these numbers through knowledge increasement to the mothers of these malnourished children, providing them with the basic condiment that is being needed to prepare the high protein diet food, and even also the basic hygiene practices that are supposed to be embedded in them, so that because you can be giving your children the requisite food that is needed for them, but if they are not being well taken care of, it won't shown at their physical appearances. So basically, we use, for us to get these children, or for us to register them, we have basic tools that we use. For instance, the Salter scale is being used to identify these children. We use the MUAC, the mid-upper arm circumference, and also based on their physical appearances.
So, ill preparation of food is one of the causes in your findings?
Sorry?
Ill preparation of food, because the food is not prepared well, is one of the causes for malnutrition?
Not necessarily. One of the various causes of malnutrition is cultural practices. In those communities, they have their cultural beliefs that children are not supposed to eat fish, children are not supposed to eat cheese, children are supposed, even if they kill a fowl and they cook it, children are supposed to only eat the foot of the chicken. So all of those practices for the father, exactly. And the segregation between boys and girls also is also been prevalent in those communities, and it was shocking to us to know that even in Western area that we are actually working, those practices are still prevalent in these communities. So we are actually changing the mindset of these community mothers and fathers also, for them to know that for them to take care of their children, everybody is equal in the family, and then they should be treated evenly as well.
Okay, continue to stay with us. She is Sabina Thompson, Team Lead Nutrition Project Caritas, now to Education and One. The Mami Malama Justice Ganawa Education Foundation is set to host its first National Education Champions Award at Kabenda Hotel to award institutions and individuals that have contributed to the educational system. Well, to tell us more about this award, I have been joined in the studio by the Chief Executive